I love change, and I know most 95% of people hate change. They don't like it, but I love it. It drives me. That's what I want to do. I want to change things to make them better. I just always think we can do better, and I think that our team allows me to do that with them, and that helps us to improve patient care. I think that we set the tone. You know, we model the behavior. Quality is number one on our scorecard. Quality is number one in our goals. And we start our meetings with quality, and we start our day with quality. And I think we model that for our teams, and they know this is important. This is at the beginning of everything that we do. It absolutely is a journey. So when we talk about zero harm, that is our goal. We're not okay with being average. We're not okay with being top decile. We're not okay with being the benchmark for national benchmark. We want to have zero harm for our patients. And so we have this culture here when we're talking about cases or deliveries. I like to stop people and say, you know, let's talk about that. That was 2 patients. That was 2 people that were impacted. That was 2 people with a family, with a husband, with a wife. Let's talk about people and not numbers, because that's why we're here. We're here to take care of people, and we're here to make sure that they walk out of that door better than when they came. They come here for us to take care of them, and that's what we need to do. And we need to do it with high quality. We need to do it with high experience, good communication. We need people to feel like they're the only ones that we're taking care of that day. And that's what I tell my nurses and the nurse leaders. Like, that patient should feel like they're the only one that's here that day by everybody that touches them.
Annie's drive to zero harm comes from a genuine passion for doing no harm towards our patients. She starts each day with a campus-led safety huddle and often conducts purposeful rounding where she engages with the team members, the patients, and the care partners to ensure that our level of care is exactly or exceeding what is expected.
She has a very high level of empathy. She is incredibly well tuned into the needs of the frontline teammate. She has never forgot her role at the bedside working night shift. She's a doer. She, makes her list. She likes to check things off, but she's also a leader in the sense of she understands her role is also to coach and develop and to set the vision.
Annie is a servant leader for sure. You can see her in scrubs on any given day. She is going to jump in and she trusts our team, but she verifies that trust, and she's right there with us, leading and guiding and showing us the way.
She really doesn't do this to expect any kind of accolade. She does it out of a sense of true concern and focus and calling. I would use the word calling around care and patient care. She also brings both a friendliness and a care for not only team members in addition to the patients, but also the intensity and the ability to both recognize and challenge at the same time. And so I think those are unique qualities. You don't find those. You find people who are good challengers, and you find people who are good supporters. The balance of that is I think, a key characteristic that she has that's part of the success we've had here at Patewood, but also her success in being able to be recognized for this.
We're all vulnerable. We're all, I like to say, wonderfully human, meaning that darkness can overwhelm our capacity to cope on any given day. But when we look at the data, and we don't have 2020 death data yet, but we do have attempt and ideation data, which I think is really relevant to hospitals. So in 2020, there were 23,975 South Carolinians that walked into an emergency room with suicidal ideations. So that's one South Carolinian every 22 minutes in the year 2020. When we looked at the attempt numbers, there were 6,801 attempts. So that's one South Carolinian every 77 minutes walked into a hospital after a suicide attempt or was carried into a hospital after an attempt. So these partnerships with hospitals are so important. We know they're coming in your doors. Now we want to partner with what do we do once they're there. So Zero Suicide is a healthcare framework that is used not only nationwide but internationally. And so the components, the metrics for the Drive to Zero Suicide Award came from that framework. So the fact that you have 20 hospital systems that qualified for that award by meeting at least three of those 5 metrics is outstanding. And building upon that, hopefully next year it's not double that number, it's triple or quadruple that number of hospital systems that are engaging, because that's a step towards preventing it, is looking at how do we train our staff, what are our policies like. So it makes me a proud South Carolinian to see these 20 hospitals getting this award. When you look at this Drive to Zero Suicide Award, to my knowledge, we're the only state really doing this on a statewide level, asking our hospital systems to come together as a collective community and say this matters and we're going to work to address this. I mentioned the screener. We're first in the nation to do that as well as we're now building the first ever South Carolina Faith Coalition for Suicide Prevention. So there's lots of things that people are looking over the fence and saying, wow, what are they doing over there in South Carolina? Because it is innovative and proactive.
A hospital is a complicated place. There are plenty of opportunities for things to happen that weren't planned. So it's no mistake. The award winners for the Zero Harm Awards are dedicated. They have spent a lot of time working through processes. They're attentive to the smallest of details, and they're preoccupied with failure. For the majority of my career, I worked as an internist, and I was really blessed to have great jobs, and I had the responsibility for working in quality and patient safety. I think very often we're unaware of those opportunities to do a better job because we're not following the data. So one is getting data that people trust. 2 is recognizing that rarely is it my fault, something I could have done. It's how can the system be developed so that any one of us who make an error or who miss something or forget something or whatever it might be is supported by others or by processes that catch those. I got to see my grandmother as she went through that last phase of her life with cancer. And I remember how uncomfortable she was because she was unable to turn herself. And when the staff would come in and turn her, or when I would turn her, she would scream out in pain. And that's what people would say to me, is that you don't understand how much this hurts when we move somebody that's like that. But I responded as, no, but I did get to see what they did after we turned them. So I watched my grandmother go from somebody who screamed out in pain, who then slept. So BlueCross BlueShield is a South Carolina-based company. This is our home. This is where we receive our care, our members, our employees, our family, our friends. The hospitals that you're recognizing today are those where we go to get care. So we're very proud of the fact that they've worked so hard to be able to receive Zero Harm Awards. We're proud to be part of that, to help support that great work. And we're very thankful for the fact that we have the health care that we have in South Carolina.